And here's probably the absolute trickiest part is if kids have a vision problem, they don't know what things are supposed to look like. So they're not going to come to you and say, oh, the words are jumping all over the page, or I sometimes get double, or I have eye fatigue and eye strain, or things are blurry up close or blurry over, things look like a funhouse mirror. They're not going to give you these specifics so that you say, oh yes, you might need glasses, or oh yes, you might have strabismus or misalignment of your eyes and have double vision that's causing these issues. They don't know what they're supposed to see. And so then it's really up to us to help them in that journey so that we can figure it out and we can assess and ensure that they've got everything they need to be able to function well in the classroom as well as outside of the classroom. Because think about it, if kids are getting a headache because they really need glasses and they are just constantly on their computers because of all the homework, they've got a headache, they might not even be able to verbalize that it's a headache, but they know they don't feel well. And that can be frustrating. They know that going to school makes them not feel well because they're constantly looking at things up close, which gives them the headache. Therefore, they might not want to go to school anymore, or they might act out. It's all interconnected. And that's why the visual system is so important for us to address first. So one of the most common issues that I see is hyperopia. Like I mentioned in the story about the child with the farsightedness, that's what hyperopia is. It's plus prescription. If you're an adult watching, likely if you wear glasses or started wearing them when you were young, you might be nearsighted or myopic. That's the more common thing. But usually people that are myopic or nearsighted, we'll talk about them, they kind of know that things are blurry far away. Hyperopia tends to be a little bit more silent. And the reason for this is we can all see when we're young, the lens of our eye can correct a lot of hyperopia. It can fatten up and thicken, and you can focus up to a large amount, up to +8 to +10 diopters when you're young. So you don't necessarily need glasses for small amounts of hyperopia. But the problem is, if it's a high amount, it really causes a lot of strain on the visual system, and it can cause a lot of eye fatigue. It can even precipitate eye crossing. And so kids have to work really hard. They may pass that vision test at the pediatrician's office, but then just like my example of my little sweet 6-year-old patient, they're just working so hard to be able to see that perfect 20/20 that they want to avoid that. It makes their eyes hurt and they can't verbalize it. They don't know the words to say that, but that's what's happening. So there was actually this really large multi-center study. It's called the VIP hip study. And what they found is that uncorrected hyperopia, this uncorrected farsightedness, was actually associated with decreased scores in preschoolers on early literacy. So it's affecting kids' ability to read, just like I said, but they can't tell you that it's affecting their ability to read. And these were kids with no other vision issues. There was no misalignment of their eyes, nothing else going on, no amblyopia or lazy eye, just this uncorrected hyperopia, which also can be very normal, but it was causing their reading skills to lag behind. So it's something to watch out for. So what about kids that have 20/20 vision? They're fine, right? Well, not necessarily. Again, most of the time, the screens, pediatricians, they're all checking distance vision because it's really actually quite uncommon for kids to have difficulty reading. If you are over 40, 45 years old, if you are like me, we all need reading glasses to see up close. That's called presbyopia. That's a different thing. That's just because we're old. As we get older, our lenses just don't change shape in that same way. So for an adult, when you go into the eye doctor, we always check distance and reading vision. But for kids, typically we just check the distance vision because it's really uncommon to have a reading issue complaint unless there's something that clues us into it. So usually your pediatrician's not going to be checking that. So that's how these kind of diagnoses get missed. But 20/20 vision actually doesn't even give us a full story. It doesn't tell us how well the eyes work together, if there's any misalignment. You could have crossed eyes and have perfect 20/20 vision in each eye. You can have something called convergence insufficiency, even where the eyes are perfectly straight for far away, but when kids and adults try to look up close, the eyes actually wander when they're looking up close. So that's another thing that can happen, and it's very difficult for anyone that's not a pediatric ophthalmologist to be able to make that kind of diagnosis. And this is where things can get a little bit complicated. There's a condition called convergence insufficiency, which is what I was mentioning. Convergence is your ability to look at objects up close. If your eyes cannot converge, most of us, when our eyes converge, they cross in. We look at something up close, our eyes cross in. Convergence insufficiency means that there's a deficit in that. So you should be able to look almost to your nose, looking at your finger. Look, see if you can see your finger touching your nose. If you can do that, even if everything around you is double, your convergence is likely normal. But for a lot of kids and adults, when they are trying to do this, they lose focus. They just cannot touch their finger to their nose and maintain the finger at least to be single because of this insufficiency of the convergence mechanism. And there is a substantial amount of overlap between convergence insufficiency and ADHD. Again, not saying that vision therapy is going to cure the ADHD or cure the learning processing issue. But if we find convergence insufficiency on an eye exam, there are eye exercises. The one time that I recommend eye exercises, you can do it with an optometrist and vision therapy if you want. There are also home exercises that you can do. And these eye exercises have been shown in studies to be helpful for this particular condition of convergence insufficiency. Now, kids with convergence insufficiency also have symptoms that mimic ADHD, because if you can't move your eyes in when you're looking at something up close, what are you going to do? You're going to avoid doing anything up close. You're going to avoid reading. You're not going to pay attention. You're going to lose focus. It might be hard for kids to be able to read all the way across the line because maybe they can start out and control it, but eventually once they've got midway down the page, it's just everything is double up close. So avoiding reading, poor reading fluency, just fidgeting, not being able to focus, those are also can be signs of ADHD. So there's a lot of overlap and one can be diagnosed as the other. And it's really important to kind of decide or determine if the child actually has both, if the child just has one versus another. But a study from 2005 found that kids with ADHD are 3 times more likely to have issues with convergence insufficiency. So that is interesting to know. And just always, it's something that I'm examining to see if that's an issue for the kids that come in to see me. Now, to be absolutely clear, that does not mean that every child with ADHD has a vision problem. My 2 children, perfect 20/20 vision, distance and near, they do not have convergence insufficiency. So that doesn't mean it's always going to be associated with this convergence problem, but it can be. And if that's something we can treat with some exercises, it might make reading more enjoyable, might decrease kids' frustration with reading, and might just improve their attention and focus for this task, which otherwise was really seemingly difficult.
For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.